My name is Chris Andrews. I'm a digestive disease specialist at the University of Calgary. Today we're going to talk about irritable bowel syndrome, or IBS. Irritable bowel syndrome is a gut disorder where the sensory nerves of the gut become overactive. Mostly when people are eating or digesting their food, you don't get a lot of signal or a lot of symptoms from your gut. If you feel anything, you may feel pleasantly full after eating, for example. In IBS, the sensory nerves of the gut become overactive so that people actually feel a lot of discomfort or bloating related to their gut function. Often, irritable bowel syndrome patients may find that their symptoms improve when they have a bowel movement, and that the symptoms are really related to bowel movements in general. Some people may find that they have constipation when their symptoms get bad. Others may find that diarrhea comes on when their symptoms get bad. Many may also find that their symptoms swing in between the two, having alternating diarrhea and constipation. All of these and every combination in between can be seen in irritable bowel syndrome. This makes it sometimes difficult to establish what exactly is the diagnosis and what is the correct treatment. There are a lot of things that can affect IBS. Even though it's a gut disorder, many things external to the gut can affect it. Diet especially is one of the bigger things. Diets that are high in sugar and carbohydrates can actually affect the symptoms of IBS and make them worse. Similarly, stress and anxiety can also contribute to IBS in that when people are very stressed, they may find that their IBS symptoms act up. It should be noted, however, that stress and anxiety do not cause IBS. They only make it worse. In most cases, the cause of IBS is not known. Often the symptoms start on their own in the teenage years or in early adulthood. Other people may find that they get symptoms starting after a gut infection. For example, after traveling or camping, people may find that they have an infection with a germ such as Giardia. Even though the Giardia clears itself out within a week or two, the symptoms will often persist for many years after. We often call this post-infectious irritable bowel syndrome. Once a person has IBS, the symptoms often do not resolve completely. IBS is a chronic disorder, meaning that there is no cure for it, but that symptoms will come and go over time. The good news is, with recognition of the disorder, education, and proper management, the symptoms can be minimized for very long periods. IBS is a very common disorder. Estimates suggest that 10 to 15% of Canadians may actually have IBS. Therefore, it's seen quite often in doctors' offices. The diagnosis of IBS is mostly made on the typical symptoms that often go on for many years. Your doctor will also need to order a number of tests, but generally only a small number of tests. These tests should include a celiac disease screen to rule out celiac disease, which can also give bowel upset. The testing should also include a complete blood count, which is a blood test that can screen for anemia and inflammation, for example. In certain situations, you may require other testing, such as ultrasounds, x-rays, or even endoscopy. These will be determined by your doctor. However, in most cases, the vast majority of patients with IBS will not need any testing other than blood tests and a typical history. There's a lot of outdated thinking about IBS. In the past, many symptoms that patients would have would be ascribed to anxiety or hysteria. Other doctors may also have thought of IBS as a diagnosis of exclusion, where every test in the book needs to be done before you can make the diagnosis of IBS. Neither of these is true. It's now well accepted by doctors all across the world that IBS is a legitimate gut disorder that arises from the gut. It can be diagnosed based on the history and some minimal testing. Many patients, however, are resistant to the diagnosis of IBS. This often arises from the fact that they may not understand or have had the IBS diagnosis explained to them in the proper way. Often, if patients don't accept the diagnosis of IBS, the search for other diagnoses can lead to excessive testing, which can cause a lot of problems in its own right. myhealth.alberta.ca is an excellent online resource if you wish to access more information about IBS. If you have symptoms that you're not sure of, or think you may have a diagnosis of IBS, speak with your doctor.